Look closely at these images, at these women, in these hospitals, overcrowded and overwhelmed, understaffed and underequipped. You see 4 women sharing one bed. You see women giving birth on the floor. Look long enough and you begin to see stories of thousands of women who give birth every day in Tanzania. This woman had her baby 1 hour before this picture was taken. Here, she's washing her own sheets because she has to vacate the bed. This is how 100,000 babies enter the world in Dar es Salaam, Tanzania every year, in hospitals like this one. We won't show you photos of mothers who died while in labor, or babies who didn't make it through their first day. They too had to be quickly removed to make room for more. Now let's put some of these images in context. Weill Cornell, one of the busiest maternity wards in New York City, delivers almost 6,500 babies in 1 year. That's 11 delivery beds, 30 full-time doctors, 25 residents, and a total staff of 100 professionals. Temeke Hospital in Dar es Salaam delivers 19,000 babies with 6 delivery beds, 2 full-time physicians, and a total staff of 25. The risk of maternal death in the developed world is 1 in 2,800. In sub-Saharan Africa, it is 1 in 16. That's what makes this current mission all the more critical. CCBRT has been operating in Dar es Salaam since 1994. Working with the government of Tanzania, we treat hundreds of the country's poorest patients every day. Repairing vision, putting children on their feet for the first time, helping kids smile, and restoring dignity to women suffering from fistula. Most of the care we give is subsidized or free. But here's a startling fact. With proper care at the time of birth, many of the patients who come to CCBRT would have never needed our help at all. Now look at these images again. When you see too many women crowded into a maternity ward, we see children with cerebral palsy, mainly caused by prolonged labor. We see blind children who went unchecked for congenital cataracts because a nurse had to move on to the next emergency. We see babies dying from infections in their first week. When you see these delivery rooms, we see traumatized women with fistula. We see children with cleft lips and clubbed feet that could have been repaired soon after birth. No one should lose a mother, a sister, a wife, or a child. But in these images, we also see hope and a solution. We see hope in the support and leadership in the government of Tanzania, which has made our mission to improve maternal health a priority. The Baobab Maternity Hospital will handle 1/3 of high-risk pregnancies and deliveries in the region, decreasing maternal and neonatal deaths by up to 50%. We have already begun through our capacity building program to strengthen maternal and newborn health care, providing vital equipment and supplies and delivering intensive training in emergency care and other essential practices. The fact is, with basic technology and low-cost interventions, most maternal and neonatal deaths are preventable. Just imagine, with this one new hospital, images like these will become faded history. The Baobab Maternity Hospital will save the lives of countless children and their mothers. This is how we see it. We hope you embrace our vision and our mission. The Baobab Maternity Hospital, honoring the gift of life in Tanzania.